The American Cancer Society estimates more than 14,000 women will be diagnosed with cervical cancer this year, and about 4,200 women will die from the disease. Well, joining us now with more is Dr. Bhoomi Mehrotra, the chair of Cancer Services for Catholic Health and the director of the Cancer Institute at St. Francis Hospital. Doctor, thanks so much for joining us.
My pleasure, Colleen.
You know, I feel like the headline with cervical cancer is that if it is preventable, right?
Yes, it is preventable, obviously very treatable, potentially curable, but really screening is the most important facet in this arena. We have to just educate our communities to encourage everybody to have the optimal screening. Despite the pandemic, unfortunately, cancer does not take a break. And still, every day, every year throughout this pandemic, there have been still the constant challenges of screening, diagnosing, treating, and the challenges with survivorship. The best thing that we can do is encourage our communities, our colleagues, to go ahead and do their appropriate screening, because as you mentioned, these are totally preventable. You know, the largest number of cases of cancer in our country are lung cancer, colon cancer, breast cancer, prostate cancer, cervical cancer, gynecological malignancies. And fortunately, these are preventable with adequate, appropriate screening measures. And we really need to get out there, do our recommended age-appropriate screening, because when identified earlier, there is definitely a much higher cure rate. As you know, we are celebrating the World Cancer Day in February, and one of the challenges is to break down the barriers, to get rid of the inequities and the disparities such that there is reach for anybody who wants to get screening, and to educate those regarding the merits of screening, particularly in these cancers where this is time-tested, data-driven, proven screening technologies. Across the world, there is consensus that if identified earlier, cervical cancer can be cured. Similarly, for lung cancer, colon cancer, breast cancer, prostate cancer. And these are our significant healthcare challenges, but we are always striving to do better.
I know that's been such a worry of so many doctors that people are not getting these life-saving screenings.
Yes.
Before screenings, cervical cancer was one of the most common causes of a cancer death for a woman in the U.S. And obviously that is not the case anymore. So it just shows you how many lives these screenings are saving. So tell us when a woman should start these screenings.
I think early age, young adulthood, obviously it is critically important also to discuss with their pediatricians about preventative vaccines, which have been shown to prevent cervical cancer, and then regularly on an annual or every other year basis. Obviously, if there are symptoms, then one should not wait. And maintaining a close relationship with one's gynecologist is critically important. But I would also encourage the conversation from adolescents and older children to discuss with their pediatricians, because fortunately there is now immunization which prevents certain infections that can lead to cancer genesis in the cervical area. So again, preventable disease, curable disease when detected early, very important to maintain those conversations with our healthcare colleagues.
Because these screenings are actually catching the cancer when it's precancerous. That's how early
Yes.
These screenings are catching things, right?
Yes, absolutely. Before they even start creating symptoms. And when they are found early, their treatment is not required to be as aggressive, but still can have significant curability. So I think it's very important that the screening starts early, have discussions with the healthcare professionals about prevention with immunization, and then monitor closely for any new and unusual symptomatology.
And start those discussions at an early age. Let's talk about some of the risk factors. Does the risk go up as a woman gets older?
Well, clearly, I think the risk of infection, particularly as you showed about HPV, I think is there. There is clearly a risk that is greater with increasing age. But I think most importantly, what is very important is that we break down the barriers that are there, that there are those that need to have the screening that are at a higher risk situation, and they unfortunately are not able to get their screening or early diagnosis. And you mentioned very correctly that we used to see a lot of late stage cervical cancer affecting women. Fortunately, with improved screening, that trajectory is changing, but unfortunately, we still see folks that have advanced stage disease where it cannot be then cured, but the goal is to control.
You know, women who are not or have not been getting their screenings, what would the symptoms be to say, okay, I need to get to a doctor, something's wrong here?
Yeah. Any discomfort, any abnormal discharge, any bloody discharge, those would be any just fullness in the pelvic area. Those are all easy symptoms to try and put in the warning side and to reach out to the healthcare professional. Clearly, any kind of discomfort in the pelvic area with vaginal discharge and a bloody discharge that is not expected is a hallmark concern.
Well, doctor, thank you so much. I think we could send this message every day, how important it is to go see your doctor if you have not, and make sure you're getting the right screenings for especially this cervical cancer, which is preventable.
Thank you, Colleen.
Thank you so much.